good evening, students. This is a short note on the azygos vein. Sometimes this azygos vein is asked because it drains the thoracic wall and part of the abdomen also, okay? The posterior part of the abdomen. Okay. In introduction, I will say that the azygos vein is present only on right side, so it is a unilateral structure, not like that of the thoracic the mammary artery, okay? So this is a unilateral structure, okay? Now this is present onto the right side in the posterior mediastinum, okay? Posterior mediastinum. Though it begins in the abdominal cavity, but its major part lies into the posterior mediastinum. It drains the blood from the upper posterior part of the abdomen and the posterior wall of the thorax, and then it drains the blood into the inferior vena cava. Now, this vein, okay, also joins the superior vena cava to that of the inferior vena cava, and thus we will see that it may be helpful in the collateral circulation, okay? Collateral circulation. Let us come after the introduction to its formation. The formation of this azygos vein, which is present on the left side, onto the right side, is from in the abdominal cavity, in the upper abdominal, okay? It begins by the union of right ascending lumbar vein, union of the right ascending lumbar vein. This is the right side, okay, of the diagram. So it is begins by the union of the right ascending lumbar vein, vein on the right side, okay, on the right side. So this is the right ascending lumbar vein, which will join by the subcostal vein, okay, the right subcostal vein. So this is the right ascending lumbar vein and this is the right subcostal vein. They will join to each other at the level of T12 vertebrae, okay, at the level of T12 vertebrae. So by joining of the ascending lumbar vein and the right subcostal vein, there is the formation of the azygos vein at the level of the L1 upper border of the L1, okay, upper border of the L1. This is one of the way in which the azygos vein is formed. Azygos vein is formed. And another, way in which the azygos vein can also form is that it may arise from the posterior aspect of this inferior vena cava. See, this is the inferior vena cava and this is the left renal vein. So it arises from the posterior aspect of the inferior vena cava, and then it may form the azygos vein by having the tributaries, the ascending lumbar vein and subcostal vein, okay? Or it may so happen that there may be a vein arising from the right renal vein and then it will form the azygos vein. But the most common type of the formation is that it is the union of the right ascending lumbar vein with that of the subcostal vein, with that of the at the level of the upper border of the L1 vertebra. Now just remember that I have drawn here the vertebral column just for the to find out the labels, okay, to find out the labels of these various veins, okay, various tributaries and there its termination and the beginning. This vertebral column, which is from T1 to L1, is not will show any relation, okay, Because this azygos vein lies in front of the vertebral bodies, though I have drawn it onto the lateral side, but onto the left margin of the vertebral column this vein lies, azygos vein lies, right? So this was the formation of the azygos vein. Let us see the course of this vein. Okay, so we have completed the azygos vein, which is usually normally formed by the union of subcostal on the right side. So right subcostal and the right ascending lumbar vein. So by the union of these two veins, the azygos vein is formed. Okay, azygos vein is formed. Right. Okay, after its formation, let us come to the course. Okay, course. So after its formation, azygos vein enters the posterior mediastinum of thoracic cavity. So how it will enter into the posterior mediastinum of thoracic cavity? Just in front of the vertebral column. That means it will first lie on in front of the T12 vertebra, in front of the T12 vertebra. Okay, this is achieved by either piercing the right crus of diaphragm, because it is on right side, so it will pierce the right crus of diaphragm, but sometime it will also enter the thoracic cavity by passing through the aortic opening of diaphragm. Okay, so there are two ways by which this from upper abdominal cavity it will go into the posterior mediastinum in the thoracic cavity. Okay, either by through the abdominal opening, and when it is going through the abdominal opening, three different structures will lie in the abdominal opening. I mean say aortic opening, sorry, not abdominal opening, aortic opening. Okay, most onto the left side will lie the descending aorta, then in the intermediate part will lie the thoracic duct, and most onto the right side will lie this azygos vein. So three structure will be passing through the aortic opening. Okay, aortic, but sometime it also passes into the posterior mediastinum of thoracic cavity, as I said, by just piercing through the right crus of the diaphragm. Okay, by the right crus of the diaphragm. Now the azygos vein ascend up to T4 vertebral level. Okay, lying in front of the vertebral column. As I said that this diagram of the vertebral column is just for reference, but this azygos vein, while it is ascending, it will lie in front of the vertebral bodies. Okay, right from T11 in the thoracic posterior mediastinum, from T11 to T4. Okay, from T11 to the thoracic fourth vertebral body. This is the level of thoracic fourth vertebral body. Okay, at the level of T4, what will happen? At the level of T4, it arches forward over the root of the right lung. Okay, so there is the root of the right lung, and then from posterior aspect it will come anteriorly arching the root of the lung, going forward, and then it will open into the superior vena cava. Okay, on the posterior aspect of the superior vena cava. This is the superior vena cava, where it is opening at the level of the thoracic fourth vertebral body, and this corresponds with that of the your second costal cartilage, external angle. Okay, second costal cartilage, which is at the external angle. So at that level, or at the level of T4, near lower border of the T4, this azygos vein then will open into the superior vena cava. So whatsoever blood it will bring, it will pour into the superior vena cava, and this is just at the level where superior vena cava is going inside or penetrating the pericardium. Okay, pericardium here. So this is the course, okay, right from the abdominal region to that of the T4 label. This is the course lying in front of the vertebral bodies, okay, of course onto the left side, okay, of course onto the left side. Let us now come to the relation, okay. So we have seen the course from its formation to that its opening into the superior vena cava, right. Let us come to the relation. Let us see the anterior relation first, and that can be better understood with this diagram. A cross section of thoracic vertebrae somewhere at 5th, 6th or the 7th level. Okay, this is the cross section is here. Or still lower level. It is still lower level because I have shown you the hemiazygos vein. So it is somewhere between 9th, 10th or 11th thoracic level. 11th thoracic level. Now see the relation of this azygos vein. What lies anterior to the azygos vein? Okay, anterior. Now anteriorly the azygos vein is related partly to the right border. This is the right side and this is the left side. So it is, this is the azygos vein, this is the thoracic duct in this diagram, and this is the flattened muscular tube esophagus. So this is the esophagus, thoracic duct. On right side is azygos vein. This is the sympathetic chain by the side of the body of the thoracic vertebral column, and this is the descending aorta on the left side, descending, and this is the intercostal, right intercostal branch, which will cross the column and then it will go into the intercostal space in the subcostal groove, and this is the left intercostal artery, okay, which will go to the left intercostal groove, okay. So right has to cross the vertebral column, okay, because the descending aorta lies onto the left side, okay, onto the. So this orientation, if it is clear, then we come to the relation. Anteriorly it is related to the esophagus. See this? Okay, partly, okay, that means the right margin of the esophagus is overlapping the azygos vein. Yes, this is the azygos, which is lying onto the left side of the vertebral column, okay, onto the left side of this body of the thoracic vertebrae. So esophagus, anteriorly esophagus is there, right? Anteriorly it is the esophagus. What lies onto the posterior side? Okay, let us see onto the posterior side. This is the thoracic vertebral column. So right from its opening into the, it's ascending into the posterior mediastinum, it lies in front of this vertebral bodies, okay, it lies an intervertebral disc. So posteriorly it is related to T5 to T12 thoracic vertebrae, okay, thoracic vertebrae, okay, T5 to T12. See here, right from here, this will lie here, T5, T6, 7, 8, 9, 10, 11 and 12. It will lie in front of the thoracic vertebral bodies and its intervertebral disc, and then this, all this label, it will be in relation to the intercostal artery, right intercostal artery, which is crossing the vertebral. So from here all the vertebral artery, intercostal artery will be crossing to the right side, and these intercostal arteries between T5 to that of the T11, they will be under, will be crossed by, will be lying on its posterior aspect, okay, on posterior. So vertebrae and intercostal artery, intercostal arteries, so intercostal arteries, okay, they will be lying posterior to it, okay. Now what lies on its right side? So this is the right side. See this is the right side and this is the left side. So what lies onto the right side? What you expect here to be there? This, the lung is here, okay, in the pleural cavity, it is the lung. So on the right side it is related to the right lung. it is related to the right lung, right pleura and greater splanchnic nerve. See, this is the sympathetic chain, and the nerves will arise from here, which will form the greater splanchnic nerve before they will go into the celiac trunk in abdominal cavity. So this will be lying on to the greater splanchnic nerve to that up, and onto the right side to this will also lie the lung and the pleura, okay, onto the pleura. So this is the relation onto the right side, greater splanchnic nerve, right pleura and right lung. And on the left side, okay, it is related to the right border of the esophagus, okay, onto the left. This is the left side. So it is related, just zoom it a little so you can see it clearly. So on the left side, it is related to the esophagus, right border, which is forming an anterior relation, but it will be also to that of the left side, okay. And then thoracic duct and the descending aorta. To the left will be descending aorta, and this will be the thoracic duct, which will be lying here, okay, which will be lying here. So I am reducing, okay, I am just have reduced it. Let us see further, okay, and in further what we will see it after the relation, we will see its tributaries, okay. Let us see the tributaries of azygos vein. Now tributaries is the how it is formed, okay, that will be the major tributaries where the formation is taking place. So it is the right subcostal, the right subcostal. So this is right subcostal at the level of T12, and then the right ascending lumbar vein, both will join to form the azygos vein. So right subcostal and the right ascending lumbar and right. This is the first tributary which will bring the blood, and if there is a connection here in the second vein of its formation, then it is connecting to the inferior vena cava or the renal vein, okay, renal vein, or to that of the inferior vena cava. Second tributary are the posterior intercostal veins. And which are the posterior intercostal vein? These posterior intercostal veins are from T11, okay, these are going into the bringing the blood from intercostal space, 11th intercostal space, 10th, 9th, then it is the right side, okay, right intercostal vein, posterior intercostal vein, okay, right up to fifth. So this is the fifth right intercostal, sixth right intercostal, 7, 8 and 9, 10th and 11th right posterior intercostal, of course. So the right posterior intercostal vein. So third will be the right posterior intercostal, okay. Second is the right posterior. Right is on the right side because all these are on the right side. So it is the right posterior intercostal vein which will pour their blood from this intercostal spaces into the azygos vein, into the azygos vein, okay. Right, after this let us come to the third tributaries, and third tributary is by the right superior intercostal. See here, this is for the second intercostal vein, posterior intercostal, second posterior right intercostal. So this is from second space, this is from third space, intercostal space, and this is from fourth. So the right posterior intercostal second, right posterior intercostal third and fourth, and all three will unite to form a vein here which will open in the arch of the azygos vein before it goes to the superior vena cava, okay, because it forms an arch and goes to the superior vein. And this combination of the three veins from the second, third and fourth intercostal space is called as right superior intercostal. This is the right superior intercostal, right superior intercostal vein, and this will open into the, so it is a tributary, okay, it is a tributary of the azygos vein. Then coming to the next tributary, it is the right bronchial vein coming from the bronchial tree, so from the root of the lung, and this will open just before it opens into the inferior vena cava, okay, where it is arching to the root of the lung, okay. Sorry. It is arching to the root of the lung, right lung, okay. At that time the right bronchial vein will open into the azygos vein. So this is another tributary. So you have noted the right bronchial vein, and then from the right side, okay, there will be so many unnamed tributaries which are bringing the blood from mediastinum, fibrofatty tissue, lymph node, thymus, pericardium, and then so many pericardial unnamed veins which will come and pour their blood, and similarly from the esophagus also, okay, this will drain the blood from the which is running parallel to it in opposite direction, right. So this is the esophageal veins, so many esophageal veins, so many mediastinal veins, so many pericardial veins, they will drain its blood into the azygos vein. So this is the, and all this which I have named here, from here to here, they are draining the blood from the right side only, okay, right side of the posterior abdomen, posterior thoracic wall, okay, right side of the intercostal spaces, okay, and posterior mediastinum, right. Let us come to see about the hemiazygos or azygos vein, okay. Now this are draining the blood from the left side of the thoracic wall. Left thoracic wall is drained by a separate set of the veins similar to that of right superior intercostal. There will be a there will be a left superior intercostal, but it will not drain to the azygos system of vein, but it will drain to the brachiocephalic vein, okay, left brachiocephalic vein. So that is the hemiazygos, left superior intercostal. We are not dealing because it is not the tributary of the azygos vein. Let us come first to the hemiazygos vein, how it is formed, okay. So one of the important tributary of this azygos vein which is present at the lower margin of the crossing to the left side here, from left to right, from left to right, this is the hemiazygos vein which lies in front of the lower margin of the 8th thoracic vertebrae. 8th thoracic, see this is the 8th thoracic vertebrae, and this is the hemiazygos vein. And how the hemiazygos vein is formed? It is formed by the tributaries, or how it arises. It arises in similar way as that of our azygos vein has taken origin, okay, or formation was made. Now this is also by the left ascending lumbar, okay, on the left side near the L1, okay, left ascending lumbar and left subcostal. This is left ascending lumbar and left subcostal, they will unite to form the hemiazygos vein, which will lie onto the left side of the vertebral column. See in this transverse diagram, this is the hemiazygos. It is not lying on front of the vertebral column, but onto the left side of the vertebral column, okay. So this is the hemiazygos vein, okay. And then this will ascend up by the side of the vertebral column, and then it will cross to the right side, crossing in front of the 8th thoracic vertebrae and sometimes the 9th thoracic vertebrae, and it will open into the azygos vein. Now if you see the tributary of the hemiazygos vein, as I said that sometime it may be formed by the union of the left renal vein or arising from the left renal vein or from the posterior aspect of the inferior vena cava, from the posterior aspect of the inferior vena cava, right. Now this will be the tributaries of the left I mean say hemiazygos vein on the left side, onto the left side. But other tributaries are the posterior intercostal vein, posterior intercostal vein on the left side, 11th, 10th, and the 9th, okay, and 8 also, so this is the 11th posterior intercostal vein onto the left side, the 10th vein onto the left side, and 9th vein onto the left side, okay. At some time there may be only up to the 9th, okay, it may be only up to the 9th. So these are subcostal 11th, 10th, and 9th, which are always there, okay. Sometime only 8th, that will find this hemiazygos, okay. They will drain their blood into the hemiazygos vein. Now then, the upper intercostal spaces are drained by another set of the vein called as accessory hemiazygos. And how accessory hemiazygos is formed? By the draining the blood from the 5th intercostal space through the left posterior intercostal vein, then the 6th left posterior intercostal, then the 7th left posterior intercostal, and 8th left posterior intercostal. If it is not going into the hemiazygos, okay, then it will go into the accessory hemiazygos, and ultimately this accessory hemiazygos, which is formed by 3 or 4 intercostal veins, posterior intercostal vein, will cross to the 8th body of the 8th thoracic vertebrae near its upper border, okay, and then it pour its blood into the azygos vein, okay, into the azygos vein. And what happens, I have already told you that from T1, T2, T3, 4, that means from this spaces, first, second, third, and fourth intercostal spaces on the left side, the blood will go to the subclavian, I mean say this brachiocephalic vein, okay, the left brachiocephalic vein, right. So these are the tributaries, hemiazygos and azygos, which drains from the left side. Now let us see what is the total area of the blood drained by the azygos system of vein. That means where the hemiazygos and accessory hemiazygos are the tributaries of the azygos vein. Okay, it drains almost except the first intercostal space, right from second intercostal space to the subcostal, okay. 11th and then subcostal. This is the 11th and then subcostal. That is all the posterior aspect of the thoracic wall is drained by the this azygos vein. Then upper part of the abdominal region through this right ascending lumbar vein, and it has a communication with the inferior vena cava. This also drains from the left side, but left side from 5th intercostal space to that of the subcostal and to the upper part of the left abdominal region. All this area is drained by the azygos system of the veins, okay, and ultimately the blood will go to the superior vena cava. So a large area of the thoracic wall is drained by the azygos system of the vein. Anteriorly, in the anterior aspect of the thoracic wall, we have learned that there were anterior vein, okay, anterior vein, thoracic vein, and they were draining to the internal mammary veins, okay, draining to the internal mammary vein, okay, or internal thoracic vein, okay. So on anterior aspect they were draining, right. Lastly, we come to the applied anatomy, and in applied anatomy only the important point is that there is a communication between the superior vena cava here on the top, okay, at the level of T4, and this communication is with that of the inferior vena cava in the upper abdomen at the level of the renal vein, okay, at the level inferior. So there is a communication between superior and inferior vena cava. Both will drain the blood into the right atrium of the heart. But if there is some blockage is there, okay, then this communication will be draining it, the blood, by bypassing it, okay. Say for example, if there is a blockage here in the superior vena cava before it opens into the right atrium in the superior vena cava, then the blood coming into the superior vena cava from the upper extremity or from the head and neck, and that of this will bypass through the azygos vein here and will reach to the inferior vena cava, and inferior vena cava then will bring this blood to the right atrium, okay. So in this way, if any blockage is there, it is taken care of it, okay. That is the utility of the anastomosis between superior vena cava and that of the inferior vena cava. Now this important short note on azygos vein, you should draw at least two diagrams, one for relation anterior posterior right and left lateral relation, and another similar diagram here for the origin or formation of the azygos vein and its termination, okay, and its tributaries. This diagram will, but you should not draw for example a column, just you give number of this and then immediately draw quickly this very simple diagram. So this completes the short note on the azygos vein. Thank you very much for watching this video.